It's summertime, and that means a lot of folks are rolling up their sleeves and getting out the toolbox to tackle some home projects. But with one caveat, sore muscles and joints to show for all that hard work. Let's welcome back Dr. Brantley Meier, chiropractor and founder of the Bridge Chiropractic. It's good to have you back.
Thank you for having me. It's always a pleasure.
All right, so back pain, stiff muscles, numbness, all these things are kind of hallmarks for some of those injuries that we suffer because we're kind of doing things out of the ordinary.
Absolutely.
Why is that?
So basically in the summertime, whether it be, like house projects or yard work, or sometimes people try to, establish a new workout plan, we increase the load on the body, and that mechanical load causes a little more stress, a little more wear and tear. And a lot of times we're starting that before we really are capable of doing that, and so that kind of leads to a few more injuries than we anticipate.
Right, and I like to refer to it as a weekend warrior kind of an injury, because all of a sudden we sort of get that fire in us to get something done that we've been putting on the back burner for so long, and then we just go at it whole hog. We give ourselves just a few days to get it done, and so we're just working round the clock. So that puts a lot of pressure on just about everything.
Yeah, especially around here, because that weather is beautiful. You want to get outside, you want to get some stuff done that you've been thinking about, and so it's pros and cons to it. Obviously it's a good thing to go after something, but sometimes, like you said, we go a little too hard.
We do. Can you name off some of the more typical areas in the body where we tend to receive that pain and feel those injuries manifest?
So a lot of times, like if it's workout related, we usually have the low back, and a lot of times we'll get neck and shoulder, like people do like overhead movements or press movements.
Yeah.
Low back can be yard work or workout stuff, but when it comes to yard work, we get a lot of knees, we get a lot of elbows, and the normal low back and neck as well.
Yeah, right. Are there any things that we can do, because we don't have a whole lot of time on our schedules, and sometimes we have to sort of just go at something and get it done and not let it linger and linger. So is there anything that we can do to our bodies to sort of prepare to prevent some of these injuries from happening in the first place?
Obviously, I'm saying go to a chiropractor
ahead
of time. No, but it may sound goofy, but like warm up. I know that people, when they're thinking about cutting their grass or doing a floor or whatnot, you're not thinking to warm up ahead of time. You usually think of like sports with that, but do small movements to get your body loose, increase the blood flow, get some lubrication in the joints. But the number one I'd say is warm up. Two, also understand what you're going to do and understand the proper like biomechanical patterns, how to properly be able to perform what it is that you need to perform. Yeah,
because we always hear, make sure you lift from the legs, lift from the back. So, but then we've got knee injuries, hip injuries, the elbows. For me in particular, I've complained about my numb middle finger that, it hasn't gone away yet. It's taking a while to heal. And what is that typically from?
So it's either called lateral epicondylitis or medial epicondylitis. Those are the two major things. You get tennis elbow or golfer's elbow. A lot of times it's from like yard work, gripping, like using a screwdriver, and I believe you were like planting.
Yes.
So anything
like
where
that.
you're gonna grip, you're gonna put more mechanical compressive load on the elbow, and that's gonna irritate those nerves that go through. I mean, you have to think about our hand; it's super dexterous. So there's a lot of nerves that go into that, and so they're gonna cross through these areas, and they're gonna be irritated.
What does recovery look like for something like that?
Depending on exactly where it's at, so we use in our office a high-powered laser. We're going to do some soft tissue work on it. We're going to try to stretch that area out, and we're going to also try to mobilize, the elbow itself, so things can have room to breathe and they can move freely. And so, it could take a couple weeks, it could take a couple months. It just really depends on the severity of the issue and how quickly or how late we're getting to it.
But stick to a plan.
Yes, always stick to a plan. I would say prepare ahead of time for what you're going to do.
Yeah.
And that's going to save us a lot of work on the back end.
And another thing I wanted to make sure to mention, we only have about 30 seconds left, but when you receive that hip pain that just won't go away and it almost feels sciatic in a way, what's the best way to recover from that? And how would you treat a patient if they came to you with one of those injuries?
After seeing the x-rays to make sure it's nothing bigger going on, we would do adjustments, and then we would do a lot of physical therapy and movements in order to, again, increase the mobility of the joints, and then to increase stabilization and strength in that area.
Okay, all right, but make sure you go and visit your chiropractor.
Yes, absolutely.
All right, Dr. Meier, thank you so much.
Thanks
Good to see you. We're back after this.